Yeah, Anita ma'am, please go ahead.
Yeah, good evening, everyone. Wishing each one of you a very, very happy International Women's Day. And we would like to wholeheartedly welcome each one of you for a session on elderly women's mental health and empowerment. And we are into the 94th session in our Deccan Positive Mental Health group. And which has Manasa Shubhakara Mind Care Hyderabad in association with the Yellow Pond Counseling Center Hyderabad, India, Forest Creative Arts Studio Punjab, Sri Deepthi Counseling Center Hyderabad, Clover Learning Center Hyderabad, Srisha Counseling Center Kozhikode, Mindstyle Hub in Kolkata. And for an introduction to our resource person, we have Mr. Putta Mare Gowda sir, who's a PhD scholar, NIMHANS Bengaluru. And a very, very warm welcome to you and the other team members from NIMHANS sir. Currently, sir has a PhD scholar. He's a senior research fellow in Department of Psychiatric Social Work and a junior consultant in the Geriatric Clinic and Services Unit in NIMHANS Bengaluru. His areas of specialization are for the last 10 years, between the years 2012 and 2024, he has been working with the elderly, healthy aging and geriatric mental health care, family mental health, human resource development and consultation, case group and community-based consultation, research and development, social welfare administration, therapy and advocacy camping. With that very, very short introduction, we would like to extend a very, very warm welcome to you, sir, and your team members. And the floor is yours. Over to you.
Okay, thank you. Hope I am audible.
Yes.
Okay. So what I'll do now, quickly introduction has been given, and hope that it's an hour session. So I'll try to finish by 45 minutes or 40 minutes. So that makes others to have a discussion or a clarification that way. So I'll try to make this presentation as easy and as simple as less time as possible. I have a few slides so that we are going to cover the topic. 94th webinar session has been introduced by the anchor. So the topic of the day today is elderly women's mental health and their empowerment. And as you know, today is the 8th March. At this right time, we are in 6:35 now. I try to finish by 6:45. I know that this is a therapy sessions for a therapist who are involved in this mental health care and other area, and it's a group of psychologists and counselors who are hopefully they are the major targeted populations here, and other affiliated people who are interested to attend this session. And thanks, this Google Meet is helping us to connect us, and I'm very thankful that TPMH team, especially the president Sunanda Ravi and secretary P. Dinakar Rao, to helping us to get connected with the people who really wanted to have this session and helping us to reach to them. And moving to that, I already got who am I and what I'm doing by the article. I'm not going to spend time on here. So moving on to this Deccan Positive Mental Health, the group of people came together to talk about mental health aspect and spreading the knowledge and wonderful aspect they're taking care. It's the Association of Yellow Pond Counseling Center and Forest Creative Arts Studio and Manasa Subakar Mind Care, Hyderabad. So this is about myself. I'm working in a geriatric clinic and service unit, our National Institute for Central Importance, National Institute of Mental Health and Neurosciences, where I work as a junior consultant, and I'm also affiliated to a PhD. I'm a senior research fellow from Department of Psychiatric Social Work. So he is my Dr. A. Tirumurthy is my senior most professor in our department, and also is affiliated to a geriatric clinic and service unit, which is mainly focused for elderly population, their care and need. Not only in a clinical setting, we do go for outreach work. And I have one more colleague, Keshav Murthy. He's also working as a PSW in our department, and he is also a junior consultant in our unit. And along with me, there are my juniors, MPhil scholars. They will be a therapist in our unit, especially Angustra Mahanta, Akil Tarakan, Lalita Padil. And we have one black placement training student who finished our master degree and doing a training here as an internship in our geriatric unit. And she will be there for 6 days. And they're all involved in this presentation, and their contribution should be appreciated in this time. And moving to that, elderly or especially women or elderly person having their empowerment in their mindset and also thinking about mental health aspect of the elderly woman, we require multidisciplinary team approach. It includes the psychiatrist, social worker, a psychiatrist, clinical psychologist, nursing, department of human genetics, or neurosciences. Because when we think about mental health, we think that it's only related to mind or related to thinking about software. But without hardware, the software may not work, or without proper software, hardware may not work. That's why the neurosciences department, including neurology, neurosurgery, also may require human genetics. That's why whatever the purple color, whatever given, no, these are the things work together as an intramura. But we require extramura support like hardware, like department of neurology, neurosciences, where human genetics, we can know the what is the brain, what are the nerve related issues that's also influencing our emotional health, mental health, psychological health, and in a larger perspective, how they are socially adjusted or deprived. Along with that, we also look into that not only allopathic medicines, what we are practicing from the English medicine, from the westernized concept, we also look into the indigenous method. Indigenous means integrated medicines. That includes Ayush, Ayurveda, Unani, Yoga, Siddhya, then Unani. Or then also looking into the whatever we provide now, it should be provided to the caregiver level or client level. It should not only a medical level knowledge. It should be go to the person who is in need. That's what Department of Mental Health Education, we work with them. And we have also epidemiology department where we have a center for public health. Whatever concern related to an individual person, we should not be stay at the individual level or in a clinical setting. It should go to the public, because public involvement is a major area. The every health aspects, especially elderly or women, the things is coming like a public health interest. That's why we say public area. So that's why we should reach out to the public and we have to involve them public participation. And we have so many other units, centers, department, they're directly or indirectly helping our geriatric clinic and service unit to make sure that the elderly empowerment, elderly care is very important. That may be a department of psychosocial support for disaster management or psychiatric rehab services, DNR, department for neuro rehab, CAM is their center for addiction medicines. There are so many family therapist units. Okay, so now to come to a topic, elderly women for mental health and empowerment. I think if you see in historical origin, it was started in the Western countries where they've started fighting for women mental health and empowerment. You see, they went like a rally and they're asking for all areas. Not mental health is not just related to having a absence of illness. It also includes their well-being. They may talk about all aspects of our health. It's not only physiological health, psychological, mental, emotional health, and social health. So that's why it's all aspects are very important. So in this time, I can say for all our over here, including men as well as women, happy International Women's Day, because we should recognize that the success of every woman should be the inspiration to another one. It's not only a woman; it's for another men also. So we should rise each other. That's why I mean all of should be rise each other. So that's why Serena Williams has given us this quotation. Also, you should think that the most beautiful thing a woman can wear is a confidence. Without confidence, we may face all adversity. Have confidence, we can face everything. So that is why 8th March we celebrate globally as an International Women's Day. To celebrate not only a social health, you have to think about economical, cultural, political in all other area. Now, if you take the Indira Gandhi, no, she politically achieved. We also look at it in cultural. There are so many Medha Patkar, so many areas they are achieving. So we have to recognize all these areas. So Women Days is not just a celebration; it's also an opportunity to reflect on what are the issues that's been taken care, how we are looking for women empowerment, what are the policies are available, and how much they are achieving this gender equality. So that is why in this 8th March, they have every 8th March they have themes. Okay, this year we have a theme called Invest in Women. That's going to increase the productivity in our nations. So we should know themes. Why should we invest in women? Because so many times we underestimated them. So that is why invest in women. So accessing the ability. Okay, so now what I am going to cover in a few minutes. So these are we are going to cover. What are the aging? So what is mean by see in the diagram in the right side I'm given no. So it's not only related to aging gender free. Now it's looking in the gender perspective. Very major statistical evidence is showing that we can say that the male morbidity and female morbidity due to the uh, person. Earlier we thinking that age only, adolescent, adult, and elderly, how they are morbidity issues there. Now if we compare in gender perspective also, there is a lot of variation. Why it is? Why the female morbidity is higher in this showing the data? See, whichever you see 80 plus and all in the color we have given, male and female. So wherever whichever data you take, so percentage is comparatively male as a more morbidity than female. So this is no, we are thinking earlier only in age perspective. Now we have to look it in a gender perspective also. Okay, and that and all we'll think about why. That's why the woman mental health and empowerment is a need of the. So there are a lot of routine issues the elderly women face in a everyday life. So what are the role of the government? What are the role for a non-government organization? And what are the role we are professionals or a human being? So what are the implications happening in our NIMANS as a center for national importance? Then some of the clarification we can go about later, and you can also comment about something you also learn something and you are experiencing some of the things. So this is the simple statistics given by a WHO. What is the percentage and what is the morbidity is happening in a different age group, and with comparison with the male and female. So we know that aging is a process. It's nobody can escape. It's an inevitable, or it's a part of our life. So it's not only just keeping in a chronological age. We say no, you are 30-year-old, you are 60-year-old. This is just a chronological, but aging is a process. Everybody will undergo. We can simply put it: aging is nothing but a later part of our life. So healthy aging is very important. We are not should think about only a number of years we are living. The number of years what we are living, that should have a life. If there is no life, there is no energy, there is no appreciation, there is no dignity. They may feel that DALY means disability associated adjusted life years. They may suffer. So as much as possible, we make them less pain, having good quality of life. So that is why healthy aging, it's not an absence of illness. So it is just as much as possible they should enjoy the aging. Okay. So that way you can say elderly is not just those who crossed the 60 plus. It's all we kept the 60 plus because policy level changes. So to do some policy, to bring some benefits, to bring that in a legal boundary, we call that 60 plus can be called elderly. But in real definition, what we can say, the person have life stages. So elderly is the higher rank of the oneself who can achieve in their lifestyle. And you also can be say that an elderly person can be an influential member in any community or in a tribal area. Even though you can say parliament, no, we have a Rajya Sabha. Why we kept Rajya Sabha? It will influence us all the legislation what we make for a public. So in there, moving on to the women's mental health, we have to know that what is health first. So health is nothing but a state of complete well-being. It may be a physiological, mental health, social well-being, and it's not just merely of the absence of illness. If you don't have illness, you cannot say that you are healthy. There may be illness, but still person can be a healthy person. So in that perspective, same. This is all given by WHO definitions. So WHO defines the mental health also is a state of well-being, part of the health. So an individual can realize what are his or her abilities and how we can cope up with our day-to-day stresses life. And third one, we should know that how we can be a productive. It's not only related to your occupational function, in your daily routine, in home, cooking, whatever we do, we should be productive. At the same time, whatever we do, as we are staying in a community, so we should contribute back to the community so that we will have a sense of belongingness. So that is what WHO defines. When we are saying mentally health, sound mind, we should have all these aspects has been achieved. Otherwise, we are missing some of the mental health aspects. So coming to geriatric mental health, especially elderly women mental health, so we should keep in mind the three concepts. One is called genetology. What is genetology? It is a study about the aging, how this aging process is happening. It includes biological, sociological, behavioral, and psychological changes in a human being at the age of 60 and above, or in a later part of the life. So in geriatrics, another one, this is a branch of medicine. So where medicine studies about same age-related areas, but the concern is more related to age-related diseases. How these are causes of these diseases. Then how can we provide the treatment for these diseases, or how we can intervene for the intervention for these elderly-related issues. Another one is called geriatric community. So this includes our dermatologists, our AD professionals, medical professionals, and also public. So here all elderly people will come, their stakeholders will come. So this is very important. The geriatric community should be strengthened. Geriatric community should be built awareness, sensitized. Then only the geriatric mental health can be achieved. So if you look at the geographical geriatric demography of in our global statistic and Indian perspective, there is a lot of changes is happening. In 2030, we are saying that 1/6 of the people will be above 60 years. In 2020, if you take, it will become 1 billion. In 2030, it will become 1.4 billion. In 2050, it's going to be double, 2.1 billion. So what we are saying, youth is a major area. We are taking youth offenders or youth empowerment. All in future, elderly care and elderly empowerment become a need of the hour. So that's why in India also, if you take the statistics, same census 2011 shows that we have around 104 million older people, and it's going to be 8.6% of our total population. Now, if you have 100 40 now, 8.6 is elderly. Now we already crossed 140. So you think about how that. Even though if you say gender perspective, the elderly women are also more in number compared to elderly males. Though the concerns are more now. So especially in India, like low middle income countries, we have more elderly population. So 2/3 of the world population, especially elderly population, is exist in low middle income countries, including India. So these are the things that we can, in one slide, I can try to make an attempt to say that what are the elderly women faces in our daily routine issues. We can say physiological, psychological, social, system related, and economic related issues. Then administrative. What are physical issues? So what are medical comorbidity, hypertension, diabetes, and they cannot move from one place to another place. Then hospitalization issues. They may not agree to get admitted, or sometimes the things demands them to get admitted. Then also they lose their spouse, husbands, they lose their children, so they feel loss in their elderly. They may go grief process. They may not able to overcome easily grief. They may require some psychological support, or sometimes they may feel lonely, and also think that socially they are not engaged, or society is not making them to be inclusive. So isolation feeling, and sometimes system is in such a way they're not adequate enough to support them. Even though their support is there, they may not accessing some stigma, facing stigma issues. Then most of the time elderly, when they get retirement, they may become financially dependent to others. They may feel insecure. They might not have a saving, or they may not be in a EPF. There's no provident fund, or they might not have any social security. So the economical issues they may face. Even though they have some old age pension or some future insurance, all this, because of a lot of welfare benefits related red tape, there may be a gap when they're accessing. There are a lot of rules, a lot of procedures they may not able to meet, or some documents discrepancies. So those are the things also make them to hurdle the smoothen of the social care. So these are some of the things usually routinely we can see the person in a normal way they face. So how these differences can be made? First of all, if we take a non-government organization, because we have more non-government organizations in support with the government or in support with the philanthropies, they are doing a lot of work. So there are so many organizations, but I am taking for the purpose of discussion few organizations. One is like Helpage India. It is working for a longer time for in the elderly area, including women. Their only target is how we can make the differences in their life, how we can improve the elderly's life. Then Asha Kirana Seva Trust, it was in 1995 they started. They started working in all areas of elderly. It's not only a senior citizen and women care, children care, disability area, because disability and elderly, that's why the social justice and empower department, they recognize elderly and disability we cannot keep separate. They become one ministry or a secretariat under that. So they have to cover both the parallel, because more disability, more dysfunctions. More dysfunction will lead to again disability. the quality of life will compromise. So health important, education important. So this is are some of the aspects go along with senior citizen care, and also especially working with rural areas. So where unreached people can reach out. So these are the whereas NGO can target community-based organizations. So then age well foundations, they're telling age well. So you should not feel age is a hurdle for us. We have to prepare for ourselves to age. So this work for the welfare of the empowering the older people. It was established in 1999, so already crossed 25 years. Then Nightingale Medical Trust is especially established in South India, major area it's covering. Since 1998, it's working. It's also NIST, we know that National Institute of Social Defense. This is the centralized institute recognized this is a NMT as a regional resource center for training. All the elderly related, they have trained. And NISD there are so many areas they selected where we have required social defense. Elderly also one of the area where we have to provide a social security. Then they also say that youth offenders, drug abuse related, or then transgender related, and begging issues. But they feel that elderly is one of the major area. So this NMT running two old age homes. Old age home mean for rehabilitation care of the elderly people. Sandhya Suraksha for women. There we have seen, we visited around 85 women are staying. They may be left out with the family, or some because of dementia, some other issues, they didn't find the family. They're staying. Once they get the family, they'll go back. And we have a Sandhya Kirana. So there is around 25 men stay there. And we have a daycare center where the person cannot indulge in activities in the home. So they'll stay in the morning and evening they'll go back to the home. Then rehab home where the person needs some recreation activity. They require some productive work and they require some rehabilitative way of managing the person. Maybe required some training for them, skill training, behavioral activations, sometimes behavioral management, especially when they have a anger outburst or would have not able to manage at home. So there are so many rehabilitative work. Okay, so coming to a government initiative, how this government or public can involve in elderly women empowerment. We know that there are science and technology now. This is a digital era. We have a lot of initiatives been taken care by government and public to meet the elderly or women empowerment. So housing related activities, drinking water, sanitization, nutritious food, providing good health facilities, providing basic education about elderly women empowerment. So these are some of the areas it's being concentrated by our policies related to elderly women. So that's why empowering women lays in empowering an world. So if you say policies, program, legislation related to women empowerment, you can make three areas major. One is medical related legislation. Another one mental health related legislation or policies. The third one elderly and their age related policies and legislation. So if you come to policy legislation in India, the major areas of we have a council for elderly person. That's called NCOP, National Council for Older Person. And also we have a policy called National Policy for Older Person. This is covers what are the areas, what are the targeted area we can look into for women empowerment or elderly women empowerment. So in that we also have a program that's called integrated program for an older person to bring all the program together to make sure that women empowerment and including women, the elderly person should be empowered. Then we also have a legislation called Maintenance of Welfare and Parents of Senior Act. Then also we have a Mental Health Act to look into their mental health, and also Disability Act (RPWD) to look into the person with elderly person having disability, how we can provide the disability benefits. So the related policies are exist. So first we have to talk about national policy for elderly, including women. What we can do, intersectoral collaboration. It's not just one person doing something, another person is living. So government something doing, non-government something. You should bring all of them together. Cooperative way, you have to look into that, how we can best achieve. Then what are the areas we can look into the intervention? Financial security. How we can, even including old age pension and health insurance, providing a basic nutritious food. And if the person is unable to stay in the home, whether the shelter facilities given, old age home also one of the institutional care. Some basic education among the elderly population and their stakeholders, how to lead, taking care of the sensitizations, providing basic welfare benefits that includes food, starting from food basic needs to self-actualization needs. Then also protecting their life and property. So many times what happens, no, we have a act, they have a bill, but who will implement? So who will protect them? Who will fight for them? Who advocate for them? So the all talks about in national policy. Then this council is the one who take the in charge to whether the policy has been implemented in effective way or not. So the bill was the program policy was given in 2011 March. They written one manual also how this should be implemented. So who is the nodal body of in our government? Ministry of Social Justice Empowerment is the nodal body to look into the all the intervention welfare benefits given by from different ministries. But social justice empowerment will be the nodal ministry. So as I told, integrated program for senior citizens, it mainly targets quality of life should be improved. So it may be providing a basic amenities, food, water, sanitization, shelter, then recreation activities. And also look for a healthy aging. It's not to just people to age. They should age with a productive way, and they should have an active enthusiasm. They have to use their capacity in an optimum level. So in under that only the NISD has been established, National Institute of Social Development. They recognizes the regional resource centers in South India or in especially in Karnataka, Tamil Nadu, this area we have a Nightingale Medical Trust. Its main branch is in Bangalore. So moving on to the bill, we have a maintenance and welfare bill. Earlier it was a Maintenance Act 2007, NWPSC. There are some of the limitations in that act. We have proposed the bill yet to be become an act. This clearly says that the elderly women, if the children are there, they are not only hired for their property, they are also taken care of the obligation to take care of the elderly person, including women. If they're not able to do, they should provide a maintenance charges or by the monthly allowance they have to give. Otherwise, they can take care of their emotional or instrumental support. And if they're not doing, they should give compensation, that not whenever they wanted to give. That should be given in a fast, speedy way, simple, and without the elderly person should not spend much money or should not spend too much time to get this compensation. So that is what this bill supports. So it's nothing but protecting the elderly women with their property, their life, and their dignity. So that is why this bill came into exist. So moving on to the National Program for Healthcare for the Elderly Women. So this is called NPHC. It is not only targeting a central level, it's targeting a community level or base level. When you started with the PSC, Primary Healthcare Center, there it was talking about how to implement the programs, how to improve the healthcare infrastructure, CSC, community health centers, then PHC, primary health centers, ASHA workers, then Anganwadi workers, ANM, GNM, social workers, then what are the psychologists, whoever is there in the either formal healthcare workers or informal healthcare workers should be targeted, and the quality of care should be improved. Then if there is no facilities now, there should be no, and sometimes PHC will be there. There will be no room for a consultation room won't be there. So the medicines will be there, whether they checked expired or not. Okay, so that should be focus of the area in this NPHC. And also they're thinking about promotion of the community-based care, integrated care. Then also providing early detection as much as possible. Age-related issues should be targeted in early and should be managed. What will happen if they manage in early? The possibility of the adverse effects will be reduced. The prevention is better than treatment. Another one is promotive aspects, and that's also preventing the further damages. So that's why geriatric training for all the healthcare professionals is very important. That is why this program is targeting those areas. So moving on to I was telling about disability, right of the person with a disability. Now elderly women has a right to claim whatever the disability benefits they can get it from the government or from the public domain. So earlier we used to call impairment when this person losing some organ or a mind or their capacity, we used to call impaired, mean they're losing. Then they slowly we changed into a handicap term because people have started stigmatizing them. They're calling that they cannot do, showing them sympathy and putting them as a barriers or putting them away from the society. Those are like we are humiliating them or we are keeping away from us. No dignity, no human rights. So then they told that why can't we should call them impaired or handicapped? Why can't we call them disability? So they have an ability, but due to some reason they lost the ability. That's why disability that can be empowered within the limitation. If they provide the equity, they can also come to mainstream. That's why the RPWD Act being
brought. Earlier, we used to call PWD Act, person with disability. That been amended in 2016, and they told that anybody who have a benchmark disability above 40%, they should be given certificate. With the certificate, they should get all the reasonable accommodation or rehabilitation in compare with a normal person. Though they are entitled to all the welfare because they are also humans. So elderly women with a disability also should get all their disability related amenities and the benefits. So these are picture shows clearly. There are different areas of disability: hearing problem, then vision problem, speech and hearing. So those things should be taken care. Then coming to mental health policy, it also talks about elderly women care. It talks what are the values we should keep it in mind, what are the principles we have to adapt when the providing the elderly women care. And also it talks about the burden which is leading to a population. See, when the woman with the mental health problem not only affect ourselves, or also affect the society where she is living. That's why I told no, women empowerment is a world empowerment. If women empowerment is not happened, their surrounding may not empower. So that is why mental health promotion is very important in the policy level. The Mental Health Care Act also supports this all policy things related. So mental health care gives advance directory. The woman, the elderly woman who have a disability or elderly woman have a mental health problem, she cannot tell how I should be treated, how should not be treated. And also she can say who can nominally represent it for me, who can take a decision on behalf of me when I'm in ill. And also they can access of any mental health benefits. If there are no money, they should get free. Affordability should not come. A person having 1 crore of land, because of the left out, she's been on road. Should not say that they are rich people should not give a free of treatment. Because at the time she was poor, at the time she is not accessing the resources, she should given a tertiary support and free of cost of treatment. That's what the Mental Health Care Act supports. Now the Mental Health Care Act become a right-based act. In 2017, it is been amended. So now we know government, non-government organizational effort is happening. Then what are the professional bodies can do differences in elderly care, or especially women care? So one, we should know that we should have a target the population with awareness, sensitize this among stakeholders, not only elderly population, their stakeholders, the women surrounded by with many people, their spouses, their children, their society, their education system. Wherever possible, we should sensitize them and build the awareness that are possible. The voluntary activities can take place. We have to become a team members. If there is no team, then approaches may not be good enough. So information providing education and communication related to elderly women care is very need of the hour, and it should be spread. And advocacy for their rights and privileges is a professional's responsibility, because many times the elderly woman, she may not fight for her rights because she's in vulnerable condition. So advocacy for her, not only a lawyer job. Lawyer may give her justice through the legal process, but professionals can play a role of advocacy to link this gap or fulfill this gap. So a lot of networking, liaising, mobilize the resources to meet these needs, very important. So when people are not reaching us, so we have to reach them. So through the outreach program, or conducting research programs, and having a developmental areas of work where we can reach the people who are not able to reach us. The main thing is welfare or empowerment. That related to a lot of administrative we have. Whether the administration is functioning very well, whether it's targeting the welfare state, whether the empowerment is happening or not. So already women, we know that they have power. Having power, we should just empower, embed it. That is what the professionals major area of work can be targeted. In that area, NIMHANS also working. NIMHANS as being an institute, NIMHANS being a lot of professionals, multidisciplinary professionals, think for these related areas. We target welfare related benefits, whichever elderly women who come with a mental health problem or abuse related issues, we make the treatment as friendly as friendly. Then we provide all the information, education, communication related to elderly, their abuse, for example, dementia, online support we provide. Every Saturday we kept for this one week or online support. And whoever comes under below poverty line, free treatment. Then Ayushman Bharat, 100% treatment free for the below poverty line. Even though they are APL category, 30% of the contribution from the central and state. Then those who have employed, government employed, their retirement, their ESI benefits, or there are pension related issues. All this will be taken care by as an additional along with the mental health area. So, and also whenever our disability, elderly person with disability, providing UDAD benefits, getting a certificate, then make sure our Nimans trying to make our system is more age friendly. Wherever possible, we put the chairs, keeping them separate counters, keeping them as much as smooth as possible, including not only patient, the person who comes as caregiver also maybe elderly person, taking care of them. So for them, we have a weekly webinar series. Not only for a person, elderly person, reach to the good. Even stakeholders, maybe a children, maybe a parents, maybe a other family member, they can also attend the programs. Because now what I'm saying adult, no, in future I'll be an elderly. Whoever is now saying adults, no, slowly they'll move to another phase. If you're not preparing for ourselves to elderly life, no, then it will be vulnerable. So we have to prepare. So Aadhaar based, many times we will feel that basic document they will difficulty to get it in your, sometimes how to get Aadhaar, how to set senior citizen card. There are a lot of online registration, but still they don't know how to process it. So that's why we have a G71 information counter. Then we have all the information and process, get it old age pension, providing a rehab services linkage. Then as I told, Vayomanasa Sanjeevani is one of the subunit, subcell of our geriatric clinic unit, where they provide the outreach programs. And we have a psychosocial work consultation on the OPD basis or in the IP based as well as outreach based. So this is the one of the initiative, as I was telling Nimans, we started in 2020 in the 1st October is an elderly day as a Vayomanasa Sanjeevani in the line with the healthy aging. The WHO declared is a decade for healthy aging 21 to 30. So with that value, what the WHO given, we started doing this healthy aging initiative webinar series. So the goal was to put a comprehensive effort to promote the mental health and well-being of the elderly older adult, including a woman. So these are some of the useful links we can further interested now. You can click on. We have some frequently asked questions. What are the geriatric mental health, especially elder women? Then what are the Vayomanasa Sanjeevani is doing? We have some healthy aging related books, and we have some webinars already we have covered, and we have some discussions. We have a Sandhya Karanji programs. Either they can attend live or they can watch it in later in the YouTube, or they can, if they want to read, they can read it in the form of books. And also there are other schemes, insurance, especially now social care will become a need of the hours. So anybody wanted to know what is social insurance, what is social care, so we can access it. Then we should know what is elderly, because I have time constraint, I have covered only simple versions. What is elder? So there are psychological definition of elderly, social, because always we think elderly mean physiological, the chronological aging. There is called physiological aging. What is physiological aging? Changes in the colors. The hair color will change. The skin may become a changes in the skin. Or eye stamina, they may bend, their bones will lose the capacity. So there are so many physiological changes will happen. That physiology. Then social changing, they may get isolated, or sometimes they become more active also. Then spiritual aging. Then we can also call psychological aging. So these are different aspects. If you put it all together, only we can say comprehensive meaning of who is elderly. Okay, that we should know. The dictionary will help us to know, and there are some article related to that, and even the government has given all the publications and manuals related to elderly and their empowerment. NISD is one of the important role here. We have to think about that's giving a training for all the stakeholders who are involved in the elderly care, especially women care. See, that's why they given a lot of publication manuals. And also every year they have an action plan, how much budget we have to keep it for our elderly care and how to utilize it for them. Then also these are the, I was telling, no, NISD, they have given a lot of courses, especially elderly related, dementia related. There are courses they are providing. And so they think that elderly care is one of the social defense. So in the women also, we know that women is more than 50%, or not less than 50% have their role. So this way I can come to a conclusion that women empowerment and women mental health care is very important in our current trending or whatever in the global concepts or a contemporary area. So any clarification, any other experience would you like to share? We can have a time, because already we reached to 7:15. As I wish, I try to finish within 40 to 45 minutes. Then we can go for a discussion.
Thank you, sir. Thank you, sir, for a wonderful and a very comprehensive presentation on women's mental health and empowerment. And we have Dr. Venugopal, sir. Yes, sir. Please go ahead, sir.
Hi, good evening, everybody. This group is not a regular group for me. So I am a physician and a geriatrician. Geriatrician means a medical doctor who takes care of elderly people. I've been a geriatrician since 1992. I started that one in United Kingdom. So for 32 years, so I'm going to share my experience-based knowledge, not theoretical stuff, and of taking care of thousands of elderly people. So here, one thing, prevention is better than cure. The mental health problems of elderly people, men as well as women, the root causes are: 1, lack of self-confidence; 2, poor self-esteem. This lack of self-confidence and poor self-esteem is extremely difficult to cure the old age, because most of the elderly people, they have a rigid mindset. They are not open to new ideas. They resist any kind of change in their pattern of thinking and lifestyle. So the best approach would be, I understand that you are having a weekly webinar on Mondays, 4 to 5 or 5 to 6, whatever it is. The ideal age group for this one will be people between the age of 40 and 60, so that they'll be able to prepare themselves for that healthy aging. Giving it to children, or giving it to very young people, or giving it to people who are above the age of 60, the outcome will be very, very poor. So target and loneliness. I gave a talk recently on webinar on loneliness, psychology of loneliness. That is one thing which is to a great extent preventable, because elderly people these days, their children are, they may have 1 or 2 children, and those children are in some other country. So they will have all sorts of mental health problems. All these policies, all these things, they are not going to fix that one. So this is what is required, prevention. For that, how to prevent the feelings of loneliness, how to convert loneliness into solitude. If you get time, watch that video, my video, it is in the YouTube. These are the areas that should be taken care of. Okay, thank you.
Thank you, sir, for sharing your valuable experience. And friends, you may go ahead with any questions.
Priyanka Shalvi, she raised her hand. Priyanka?
Yes, ma'am. I want to ask that how to overcome from the situation which is not in your hand, and your situation is totally unbearable, and you are living in a environment which is totally negative for you.
Okay. Shall I make an attempt? Yeah, because most of the why we say attempt, no, finding a right based the right moment answer may not possible. The thing is, the person in particular situation, the adversities what they go no, it's very different. Without giving details what is happening and all, commenting about that, it's very difficult. But what I can tell at this point of time, we prepared 2 FAQs, frequently asked questions related to mental health of the elderly person, including women. So what I can do, I can share with our Anita Ramachandran what are the common frequently asked questions, what are the helpline available in our and if some person as was sir was covering, Venugopal sir,
what happens with the loneliness, how to get the loneliness free. And also when the elderly person is there, not only elderly person will suffer, the providing the care for the elderly, the other family members or other stakeholder of the person definitely have the time and their energies will be spent. And there's an issue comes me time. Me time means everybody has a 24 hours. Everybody has their well-being. So sometimes when we are providing care for others, it's also shortage in our personal care. That's why even the balance between personal and professional we say, the same way care options are nowadays becoming a question. How and what way we can provide in a best way. So whatever the questions you ask, it's more related to person centric, where we have to look at the person, how better we can help out. So first we should know grievance. What exactly the grievance? What is the source of that grievance? How it is coming? And what are the possible strategies? For example, you can use the helpline number. Sometime we can address, and we can use the police force. It's along with the elderly helpline, it's working, and we can use the healthcare professionals baseline. And it's not, then we can use the professional healthcare workers. Then we use the lawyers as the mediators, and we can use the public. We have a very what sensitized. We should not say the public without awareness. Public should have awareness, and they should be sensitized. Many people have knowledge. Many people know the elderly abuse. They are the witness, but whether they are assertive, whether they're questioning, whether they're standing for them, that's the issues. That's a sensitization. Make the people taking care of them. See, if the person talking about elderly related issues, when he become an elderly person, the same person might have violated the what is the obligation towards their parents. So that is why sensitization from the child. That's why now geriatric intervention doesn't start in the elderly care. It starts from the birth. The person who birth and they're going for a preschooling and they're going for schooling, there I have to think about syllabus whether related to elderly women, elderly care. So instead of addressing a single problem, what I'm giving in general, because I don't know exactly what exactly the person, but every problem can be addressed with the proper interventions. Maybe not giving 100%, but something is better than nothing. Intervention is better than, that's why sir was telling, prevention is better than cure. Okay, so now it's the concept changed. Instead of cure, we say that treatment. Many things has doesn't have a cure, especially dementia. Only 1% chance of treatment cure. So that is why prevention is better than treatment. Getting a treatment when it is possible, second person involving. The first primary level, if you're taken care, if they are taking care of responsibility, if they're taken care right-based approach, then third person involvement like police, elderly helpline, professionals, the percentage will be reduced. That's what I believe. I think I tried to answer your question. Otherwise, you can always come back to us. And I also done so many webinars related to elderly, loneliness, social care. So it's available in our YouTube, Vayomanasa. I think.
Wonderful answers, sir. I have
Okay,
a doubt. What are the possibility for online sessions? Any certificate course is there?
Yeah. So as I was telling about, in central level, we have NIST, National Institute of Social Defense. They are giving all courses are free. 1 month course is there, 5 days course is there. Then we have a 3 months courses. So what they are giving, 3 months courses for those who are in this field, healthcare related field. What is 1 month course? No, they may not be in the healthcare field, but they really wanted to work in this area, like paid attenders. There are 1 month course. But now people are working in another area, but really concerned about elderly. For example, police department. The people are really working for a elderly, but whether they sensitize. So 5 days induction training, and they're also providing 3 days induction training for social workers, those who are working. This is nothing but they have a knowledge, they know, but sometimes our emotions is not in a control how to handle the things. So they give a need-based on hands-on training. So that's all more of the trainings are online because feasibility purpose and also cost effective. But there are courses offline also available. IGNOU, Indira Gandhi National Open University, they are providing distance education. All of it, even geriatrician can do, some MBBS holder can get done. Some those who have done any degree holders can register. Distance means they'll give 1 month class, rest of the things they can finish. Then open schooling they have. Now elderly and women empowerment become all the syllabus also. All the formal education has included this here. And now there are so many training centers established. NIST, I'm telling you, NIST is doing all. And even Vayamanasa, we are started online in the COVID time. Now we have started offline also. We are training the volunteers in psychosocial support how to provide. There are students from the university that are coming as a 2 days in a week, attending our OPDs and listening how the patient's care is important, how the caregivers can be attended, and they're attending all our academic activities. They're learning and taking home to their institute, and they're discussing, brainstorming. And our unit also have a lot of in-person discussions. And we have a training of MBBS, training of fellowship students. We are training so many trainings is happening. But the thing is, whether the research and evidences, what we got it in our clinical and institutional setting, whether reaching to the community, whether we are training the trainers, whether we are reaching to the outreach, whether those who are not reached. That is the targeted area. Only training may not sufficient. The training should go to the person who is in micro level. Okay, that is what I mean to say. Capacity building is very important.
Thank you, sir.
Search it in
Thank you, sir.
you will get some online training program. And even Swayam is the one government initiative. MOOCs, they are also giving so many courses. Any person who has a 7th standard, 10th standard also can join those courses. And there are some technical courses also. Swayam is also providing. And a lot of international organizations also providing. I support one program is there. And so many manuals have been published. But the problem is people are not accessing and doesn't spending time to get the knowledge. There are so many things are available, even database available. But reaching to the people in a right manner and making them to understand, all the professionals and all other stakeholders should be enthusiastically taken care of. This is the action. Action is the important place, I believe. Instead of only teaching is more important, but also action is at the same time.
Yeah, Kalyani ma'am, Shamla ma'am, you have any doubt? You want to interact with sir?
And you people also can share your experience, because we take experience only based on our clinical experience, our case vignette. There are so many case vignette and based on clinical things and based on our experience. And you can also share your areas where you are finding some association come together, they're working for their helping.
Yes, ma'am, Kalyani ma'am.
Yes, good evening, everyone. As Sir said, he actually has covered all the points. But I would just like to share one thing. Like, my mother-in-law is about 90 now, and she was, she was a very active person, a person who was very dynamic, and she managed the house very well and all that. But now she is going through a little bit of this thing, like, though she's not lonely, there are people around her, but still she's a little withdrawn and all that. So also I think her routine is like she gets bored, because she was very active when she was young. She used to drive, she did her law, she was a law graduate, so very well read. So, but now, because she's not able to read and all that, so what we do for her is we engage her in activities like word searches and coloring, and give her some kind of artwork, and because she's good at that. So something hands-on, so that, and like writing and reading and little bit with a bigger font. So I just wanted to share that. So that keeps her little brain stimulated. So that's how we are we created a routine for her where she does all this. We take her for a walk downstairs. So I mean, this is the action plan for her. So I think that is helping actually, because that way we interact with her, talk to her as much as we can, like that. So I just wanted to share this. So these are things which keep her little active mentally.
Good that you shared your experiences. These are the individual case-based evidences that we are doing very well. So we should know two things. What you told, that need assessment.
Not necessarily you have to do in a professional way. Anybody can understand their needs. Only two needs. What are the major needs? Instrumental needs or emotional needs. Many
Correct.
time what will happen is the ADL, IADL. Adequate self-care should be there. At the same time, adequate support, instrumental way, like doing. Many people may compromise this one or other way. And we should also know the brain functions.
Correct.
Elderly person is coming, there are chances that people may not as function as earlier, but the needs cannot be changed. Needs are same. So what we can do, the caregiver over is the support system. It should be the person should make the things to be available as a need. See, person brain, frontal, there is part is not working. So the caregiver frontal lobe can work for them. So we should make the thing is we are not compromising the need what they're supposed to get it. For example, person cannot ask himself or herself, I need to, because of decision making power may have gone or self seeking thing might have gone. So basic assessment, what are their need as a human being? If I would have been, what is my need? If we do ADL, IADL, then we can have a behavioral activation. Behavioral activation is routine activities. That's why tailor made based on the need of the person and based on the environment where he or she lives. So this you can consult somebody, any professionals, those who are working in health. Otherwise, you yourself can make a self-help, a lot of materials about how to make an activity structure and how to
Yes.
provide. See, the person may be varied. Person with dementia is different. Person with depression is different. Person with diabetes, but all their needs are the same. What are the needs? Basic needs. Maslow's hierarchy needs you take from base level to self-actualization. How much they need, how to get it. Whether they themselves they can get it or somebody support. There may be primary level support, secondary level support, or tertiary level support. They want institutional care, don't guilt feel. They want rehabilitative care, provide rehabilitative. They want daycare center, provide that. And you also provide care. But you should not feel guilt that I am not providing care. Why should I have to put it under it? Put a daycare center, let them train, provide all the instruments, give the money to the institute, go and visit the organization, and take them back at the evening. You earn money for them. That is why we should balance both emotional as well as instrumental. If you are unable to give instrumental, provide emotional. For example, rural place, no, they may not have much instrumental, but they support emotional support. In urban setting, no, we may not be able to provide emotional support because of both the parents work, both the children work. For example, the son is there, son also working, daughter-in-law also work. The children are busy with the computers, mobile, their education. Then we may putting in an old age home as an institutional care. We may provide all the instrumental needs, but at the same time, we should not compromise the emotional care. Over whatever care institutional given, no, the family care cannot be substitute. So that's why you should balance in that way. Otherwise, go back to the joint family system. Is it possible at this time of urbanization, globalization, civilizations, what we call in the technical or mechanical life? No, some of the things may not possible to go back, but still we can achieve with the whatever the existing instruments, institutional care is available, hospital-based tertiary care system is there. Somehow the quality of care should not be compromised in any area or in any time. That's what I feel. The good way you got out the concept. Everybody should look into this way.
Thank you, sir. It was a wonderful thought sharing. Very informative session. I think we are expecting more sessions from you in upcoming months. Thank you. Yeah, ma'am, you can go for VOT.
Yeah, thank you so much, Sunanda ma'am, for giving me an opportunity. Sir, thank you so much for that wonderful, very informative and comprehensive session. And kindly accept our gratitude on behalf of the Deccan Positive Mental Health team, which has the Yellow Pond Counseling Center, India, Manasa Shubhakara, Mindcare Hyderabad, Sri Deepthi Counseling Center of Hyderabad, Clover Learning Center, Hyderabad, Srisha Counseling Center, Kozhikode, and Mind Style Hub of Kolkata. And dear friends, we will meet with yet another beautiful session next week at the same time. Until then, it's a goodbye from all of us here. Take care and have a wonderful weekend. Thank you all once again. And thank you, sir, so much. Thank you very much.
Thank you.
Thank you, friends. Bye.
Thank you, sir. Thank you. Bye.
Thank you, ma'am.